Hi, in this video I'd like to talk about hysterectomy once again and how invasive and destructive it is. Now, a lot of doctors recommend hysterectomy because it's simply much more easier to just remove the uterus than deal with the underlying cause. So which is why we say hysterectomy actually is just treating your symptoms. It's not dealing with the underlying cause because of a lack of a specialization or skill from the surgeon. And another cause is that it's much more easier to just remove an entire organ than to actually do some highly technical laparoscopic surgery or hysteroscopic surgery. Why not just remove it? It's much more easier for the doctor. And then they can also cash in, and then the patients also do not question them because of their doctors. Patients rarely question them, only listen to their instructions. And then another thing is they also can protect themselves from legal actions from their patients. For example, let's say a uterine fibroid or endometriosis. How is it going to recur if they are just straight up remove the uterus? There is no place for it to recur. So it's much more safer for these doctors and hospitals. A lot of ways they are actually conning these patients. In many cases, it's not required. There's only two circumstances where hysterectomy actually should be recommended. One, it is a malignant cause, something that is cancer and spreading aggressively. This is a valid reason for hysterectomy. Next one is a life-threatening condition. It could be an excessive bleeding or some underlying condition that is potentially threatening the patient's life. Then hysterectomy is a management method that must be considered here. Otherwise, for other causes such as uterine fibroids, benign fibroids, endometriosis, adenomyosis, anything wrong with the uterus, actually there is a treatment method to deal with this underlying cause. You need to find the correct surgeon. Otherwise, they will just, for their ease and convenience and legal issues as well, they can just straight up recommend you hysterectomy. Patients also do not know any better. They don't seek any other second opinion. And then all other doctors are also saying the same thing, hysterectomy is good for you. But they don't tell you about the side effects that come along with it. They don't prepare you, they don't offer you any remedies or treatment for that, just for their own convenience and not for the patient's best interest. So I hope you understand that hysterectomy is a very invasive and not recommended. If your doctor is saying you need hysterectomy, ask him if its underlying cause is malignant or is it life-threatening, and then get a second opinion, get a third opinion. You might get something different. Don't just blindly follow your doctor's hysterectomy treatment recommendation, because it's not him that is going to bear the consequence. These consequences are lifelong and also bring you a lot of pain and affect your quality of life. Antai Hospital has a philosophy of always saying no to hysterectomy unless it is the two mentioned circumstances. We have the specialty, the skills to actually treat your underlying cause, not just remove it so that your symptoms go away. The underlying cause, once it's treated, and then you can recover. You don't need to remove your uterus. Now, get in touch with us if you'd like to find out more information. Also, arrange consultation via our website, and also leave me a comment on